We would like to welcome you and your family to the orientation session of the Pediatric Chronic Pain Program. We hope this presentation is informative and helpful for you and your family. Why do we have an orientation session? The purpose of this presentation is to help you and your family learn more about our program. It's probably very different from other clinics you've been to in the past. We want to introduce various team members and how we work together to help youth and their families to manage pain. Finally, once you've learned about us, you can decide if we are the right place for you. We hope we are, but if you're not, to learn that now will save you a lot of time. What will we talk about today? We're going to talk about chronic pain because it's different than the kind of pain from stubbing your toe or breaking your arm. We're going to talk about our amazing team of healthcare professionals and why we have such a diverse group of people working together. We're going to talk about our framework for chronic pain and how we decide who in our team will work with you and your family. We're going to talk about our hopes for you and what to expect at each visit. We're going to give you an example of a child who has successfully went through our program. We also hope that you will have a few more resources at your disposal to help you as you wait, and some helpful tips to start moving towards managing better.
What is chronic pain? Acute pain is pain that lasts for 3 months or less and is associated with tissue damage or infection. This pain serves a purpose to protect us from further injury or infection. Putting your hand on a hot stove is an example of acute pain, and the pain tells you to remove your hand so you do not cause further tissue damage. Chronic pain is pain that lasts beyond healing of tissues or infection, generally after 3 months. It can be the result of another illness, like arthritis. Sometimes chronic pain starts as acute pain, but this does not have to be the case. Because tissues have healed and infections are gone, we cannot explain chronic pain by tissue damage or infection. Rather, we need to look at the role of the nervous system. Chronic pain results in unhelpful changes in the nervous system, where it continues to send danger messages despite no danger being present. We often compare the changes in our nervous system to a car alarm. Generally, to set off a car alarm requires damage to the car, like a broken window. But sometimes, a car alarm will go off when there are no signs of danger, such as the gentle brush of someone going by. Treatment for chronic pain is very different than acute pain, where rest and medicine are often very helpful. In chronic pain, treatment is focused on getting back to doing the activities you love, using various skills and strategies so that pain does not interfere. Here is a short, fun video from a pain group in Australia called Chronic Pain Explained in 5 Minutes.
Everyone agrees that pain is a universal human experience. We now know that pain is 100% of the time produced by the brain. This includes all pain, no matter how it feels, sharp, dull, strong or mild, and no matter how long you've had it. You might have had it for a few weeks or months. This is called acute pain, and it's common with tissue damage, say from a back injury or ankle sprain. And generally, you'll be encouraged to stay active and gradually get back to doing all your normal things, including work. Or you might have had it for 3 months or more, and this pain is generally called persistent or chronic, because in this type of pain, tissue damage is not the main issue. What's less clear, though, is when you're told you have chronic pain, is knowing what's best to do about it. Well, in Australia, chronic pain is a really big problem. In fact, 1 in 5 people have it. Having a brain that keeps on producing pain, even after the body tissues are restored and out of danger, is no fun. Some people say it still feels like they must have something wrong. But that's just it. Once anything dangerous is ruled out, health professionals can explain that most things in the body are healed as well as they can be by 3 to 6 months. So ongoing pain being produced by the brain is less about structural changes in the body and more about the sensitivity of the nervous system. In other words, it's more complex. So to try and figure out what's going on, you need to retrain the brain and nervous system. To do this, it's helpful to look at all the things that affect the nervous system and may be contributing to your individual pain experience. What can help is to look at persistent pain from a broad perspective, and by using a structured approach and a plan, it's less likely that anything important will be missed. Let's start with the medical side. Firstly, taking medication can help, but only to a limited extent. It is the more active approaches that are necessary to retrain the brain. So using medications to get going is okay, and then mostly they can be tapered and ceased. Some people also think surgery might be the answer, but when it comes to a complex problem like chronic pain, surgery may not be helpful. So if you're thinking of surgery, it's best to get a second opinion and remember to consider all the things. Next, it is helpful to consider how your thoughts and emotions are affecting your nervous system. Pain really impacts on people's lives, and this can have a big effect on your mood and stress levels. All those thoughts and beliefs are brain impulses too, but you can learn ways to reduce stress and wind down the nervous system. This helps with emotional well-being and can reduce pain as well. The third area to consider is the role of diet and lifestyle. Now, it turns out that our modern lifestyle might not be so good for us. In fact, what we eat and how we live may really be contributing to a sensitized nervous system. Looking at all the things like smoking, nutrition, alcohol, and activity levels, and seeing if there are any issues is a good beginning, and these things can go on your plan. Then there's often enormous value in exploring the deeper meaning of pain and the surrounding personal story by stepping back and looking at all the things that were happening around the time the pain developed. Many people with pain can make useful links between a worrying period of life and a worsening pain picture. For many, recognizing deeper emotions can be part of the healing process. Last, but by no means least, is physical activity and function. From the brain's perspective, getting moving at comfortable levels without fear and where the brain does not protect by pain is best, and you'll gradually restore your body's tissues. So, to sum up pain, it comes from the brain and it can be retrained, and when looked at from a whole person or broad perspective, gives you a lot of opportunities to begin. So, get a helping hand if you need it, set a goal, and begin.
So what are our program goals? The bottom line is that we want you to feel like you have control over your pain, not the other way around. We want to work on building skills and strategies to manage your pain better, like building an imaginary toolbox. If you have more tools, our hope is that you can then enjoy activities and events and the pain won't get in the way. There is not a quick fix to change the nervous system to become less protective. Rather, learning to do things a little differently will help rewire your nervous system to calm down pain. To learn how to manage your pain better requires a lot of hard work, patience, and commitment from both youth and their families. We will work with you and help you set achievable tasks each week. For example, to help with sleep, we may suggest you slowly move your wake-up time earlier. To manage school better, we may suggest you take breaks during the day to do calming activities. These are just a couple of examples of how our clinic will work with you. We also realize that chronic pain affects the entire family, and so we try to incorporate families as much as possible into our treatment plan. Pain will not necessarily go away during the course of treatment. It would be awesome if we could take away your pain immediately, but we can help you to learn how to manage your pain and focus on getting back to doing the things that are important to you and your family. As mentioned earlier, there's no quick fix to chronic pain. Rather, youth have to get back to everyday activities before the pain starts to get better. What are our program goals? We won't be focusing on your pain score, as we also do not measure one's progress from pain ratings. As we said before, sometimes pain ratings don't change or take a while to change, but we want to help you learn to do things slightly differently to allow you to participate in activities that are important to you and manage your pain. This is what we mean by a functional rehabilitation approach. Our clinic uses a biopsychosocial model of chronic pain management. Chronic pain models of management have changed a lot over the years, and the biopsychosocial approach is the framework our clinic uses to guide our assessment and treatment. It helps us understand things that may contribute, maintain, or relieve a young person's pain. The biological and physical factors include your family's health and genetics, your individual physical makeup. Psychological factors include things like general mood, stress, and how you feel about your life in general. Social factors include things like cultural values and beliefs about pain, your relationship with friends, school supports, and family responses to your pain. This is why at your first appointment we ask you many questions about your family, past injuries, and also screen for mood and anxiety concerns. We know that we can't look at each of these factors on their own. We use this information, along with the goals you set, to set a plan that's right for you. This is our Pediatric Chronic Pain team. Now that you understand our framework for understanding pain through the biopsychosocial model, you might understand why our chronic pain team is so large with such a variety of disciplines. We have physicians and nurse practitioners on our team. You will be followed regularly by the physician or nurse practitioner who you'll meet at your intake appointment. Medical follow-ups are needed to monitor your symptoms, prescribe or monitor medications, and review your progress during your time in our program. They will also keep your family doctor or pediatrician up to date. You've most likely spoken with our nurse practitioner already, who helps support our physicians. The nurse practitioner does a lot of work managing our referrals and wait lists and provides education to our patients and families on pain science. We have psychologists and social workers. You'll meet one of them at your first intake appointment. They want to learn more about how you are coping with pain. As we know, chronic pain can be very hard to deal with and affects your thoughts and feelings, and your thoughts and feelings also affect your pain. Our psychologists and social workers work with youth individually to help with these strong emotions and learn coping skills to manage pain better. Sometimes our psychologists perform mental health assessments to help diagnose problems like depression or anxiety. We also have physiotherapists and occupational therapists. Physiotherapists work on our team to help youth gain confidence in increasing their physical activity and manage their pain, or might help youth get back into a sport or activity they can no longer do because of pain. Our physiotherapists may also help with teaching kids to use their foot or arm again, or learn to walk again following chronic pain. Our occupational therapist helps youth to attend school more regularly while learning skills to manage during their time at school. The occupational therapist also helps youth learn how to develop healthy routines and structures, as we know that consistency and routine are very helpful in managing pain. We have more members on our team. We have amazing business clerks who help us organize our schedules and will help you make appointments for each visit. A child psychiatrist is available by consultation for youth with complex mental health needs.
What to expect at your intake appointment. It's very important that you come to your intake appointment with one or both of your parents and caregivers. At this appointment, you will meet with a physician and a social worker or a psychologist. Our goal at this appointment is to learn more about you and your family, understand your pain, and how it is affecting your life. At the end of the session, our plan of care will be recommended to you and your family. What to expect at follow-up visits. After intake, most families will attend a pain science session that teaches families and youth the most up-to-date information on chronic pain and how it differs from acute pain, especially in its treatment. This is a very helpful session to understand your treatment plan and how we are going to help you manage. The more we can understand chronic pain, the better youth are able to manage it successfully. Most youth are recommended to have a goal-setting session where we want to hear from you areas of your life that are most important to work on during your time with us. We will be revisiting your goals often and rating and re-rating your progress. You may work with one or more clinicians during your time here, depending on your goals and our team's recommendations. Our parent group. Most parents are encouraged to participate in the parent group as they play such an important role in their youth's management of chronic pain. The group is 5 weeks long and includes various topics listed here. At your intake appointment, we will give you information about upcoming dates for the group.
Here's a case example of a young soccer player. Nina is a young girl who sprained her ankle, and the pain in her ankle continued after the injury healed. Because of pain, she had to stop playing soccer and eventually stopped all physical activity. Even walking short distances caused her pain. Mina missed a lot of school since this injury, about 2 to 3 days per week. Her sleep was disrupted, she could no longer get comfortable, and she always felt tired. Mina stopped connecting with her friends and felt a huge loss with not participating in soccer. She became very worried about her pain and also felt sad about her losses. As you can see in this case, you have to consider all factors when dealing with chronic pain: the physical factors, social factors, and psychological factors. We cannot treat them in isolation, and working together as a team, we are able to provide comprehensive treatment of the entire individual. Mina attended an intake appointment with a physician and social worker for her first visit. It was recommended that Mina and her family learn more about chronic pain in a pain science session, and that having a goal-setting session with our team would be helpful. Mina identified playing soccer again on her school team, attending school regularly, and working on her sleep as extremely important to her in goal-setting session. Based on information gathered at our first intake appointment and our goal-setting session, it was recommended that our physiotherapist work with Mina to increase her activity level and work on a gradual plan to return to soccer. It was recommended that our occupational therapist work with Mina to support greater attendance at school, and a psychologist help Mina manage her emotions and worry around her pain, as well as help improve her quality of sleep. Mina's parents learned more about helping to support Mina by attending a 5-week parent group. Finally, Mina had regular monthly follow-ups with our physician. As you can see in this case, you have to consider all factors when dealing with chronic pain: the physical, social, and psychological factors. We cannot treat them in isolation, and working together as a team, we are able to provide a comprehensive treatment of the entire individual. Through the course of her treatment in our program, Mina started attending her soccer team's practices, first by watching, then participating in warm-up and drills, and slowly introduced the gameplay. She benefited from reconnecting with her friends on the sidelines and managed her symptoms by not pushing through the pain. She worked on her school attendance by creating a plan to slowly increase her time at school and learned to take breaks throughout the day for movement and calming activities. She worked on her worries through talk therapy and developed coping strategies such as mindfulness and relaxation.
Here are some key messages that we would like you to remember from our presentation. A multidisciplinary approach to chronic pain, addressing physical, social, and psychological aspects of youth, has been shown to be the most successful treatment approach to chronic pain. Changing the way you do things takes a lot of hard work and practice, and our team is here to help support youth and families. Youth and families that attend regularly and do the weekly home practice get the most out of their sessions. Pain can take a while to change, and we have to make changes to our function before it improves. This helps rewire the nervous system to be less protective. Here are some questions that were frequently asked. Does your clinic run tests and provide a diagnosis? The Pediatric Chronic Pain team does not provide diagnostic workups. We hope that this has been done before your entry into our program. Chronic pain is a diagnosis in itself and refers to the changes in the nervous system where danger messages continue to be sent when there is no danger. Is there a medication that can help? There are some medications that can help support the work you do with our team, but only taking medication to help chronic pain will probably not be successful. Will my child be pain-free? We can't promise that you'll be pain-free, but we can help you get back to doing the things you love most. We hope to put your life in the foreground and pain in the background. How long will I be involved with your clinic? We can't say for sure how long you'll work with us. It depends on a lot of factors. Generally, appointments are more frequent at the beginning of your time with us and will decrease as you progress through our program. What if I need more intensive supports? If we feel you may need more intensive support, we will make recommendations to programs outside of our clinic. Now that you've watched this presentation, decide as a family if you're interested in our program. Share your decision with us. You can do this by responding to the email from the clinic or by calling 905-521-2100, extension 73049. If you have any questions you need answered before you can decide, phone the clinic and someone will get back to you. Once you've confirmed that you want to attend our program, your name will be added to our waiting list. You'll be contacted in the future when an appointment becomes available. We have some helpful hints while you wait. Chronic pain is real and can be just as intense as short-term pain. For most youth, pain decreases slowly as you start to get back to activities you enjoy. Trying to keep regular routines can be helpful. Sleep, school, exercise, seeing friends, and not overdoing it. We have some helpful resources for you while you wait. We encourage you to explore these resources. They discuss a lot of the same topics we do in sessions and have helpful videos to explain the concepts. Please contact our clinic if you wish to receive further recommendations. That includes our orientation session. We hope it was informative and helped you learn more about our team and how we can help you.